Okay, for me, that was a fast 10 minutes. But we have to get started again and continue our quest for knowledge, right? So that's what we're going to do. So we left off here in the middle of kidneys. Actually, we're kind of at the end of kidneys, and we're going to talk about malignant renal disease that you can see sonographically. So there's essentially two kinds of cancers that you'll see relatively commonly in dogs and cats that are associated with the kidneys. Probably the most common one you're going to see is going to be lymphoma. And again, especially if it's a cat, we learned that anything south of the neck or caudal to the neck is you're going to bet lymphoma. And cat kidney lymphoma is really, really common. You can also get adenocarcinomas of the kidney in both dogs and cats. Sonographically, again, there's no way to differentiate what's an adenocarcinoma versus lymphoma. And so you'd have to aspirate or biopsy the kidney or take the kidney out itself for histologic analysis to know really for sure what you're looking at. So what do we look for cancer of the kidneys? Basically, we look for things that we've already described. So we look for a very large, ugly, irregularly shaped, heterogeneous mass that's totally deranging the normal architecture of the kidneys. Okay, so if I look here, here's a zoomed up part of a kidney. So that looks like normal kidney cortex. There's a little medullary here, there's a little medullary here, but it's got this very large solid mass associated with the caudal part of the kidneys that's sitting right in that area in there. So a very large, solid, mixed echogenic, ugly mass. It's probably bulging the capsular surface of the kidney. It looks nothing like a normal kidney parenchyma. This, again, you use all the other information that you have. This would usually typically be a middle-aged to older animal, and it looks ugly and nasty. And so the only way to know for sure would be stick a needle in that and look at the cells to make sure that it's not something benign, but something like that is going to be that's really deranging the capsular surface of the kidney and the cortex of the kidney. You're going to bet malignancy most common. Some cats that get lymphoma, their kidneys become really hyperechoic and they're huge. They can get like twice their normal size if they have lymphoma. And not uncommonly, when you have adenocarcinoma or lymphoma in a kidney, not uncommonly it's bilateral, which is a little weird, but so it can be bilateral and affect both kidneys at the same time. Okay, urinary bladder. Let's continue with our discussion of the urinary tract, and we're going to go to the urinary bladder. The urinary bladder is very easy to find, typically in dogs and cats. A lot of people, when they learn ultrasound, they start with the bladder because it is easy to find, and right off the bat, it increases your confidence that you're going to have a good day, right? You're going to be able to find things because, boom, you stick your probe on the animal's abdomen, and there it is. There's the urinary bladder, so it makes you feel good about yourself. Okay. The only time you'll ever have difficulty finding the urinary bladder is if there's hardly anything in the bladder and it's like an unblown up balloon and it just kind of shrivels upon itself. And sometimes it kind of moves back caudal to the pelvic area and it's very hard to find. But most of the dogs you're going to see and cats that you're going to see come in, they're going to have, even if they just urinated, they'll still have a little bit of urine in their bladder that you can make it to where you can find it. So typically the bladder is going to be variably sized. It depends on how much urine is in it at the time that you ultrasound it. The mucosal surface of the bladder wall are nice and thin and smooth. The outside serosal surfaces are nice and thin and smooth. Depending on how distended the urinary bladder is, will tell you, how many layers it might look like it has. Normally, you can see defined layers of the bladder wall. The bladder wall itself is made up of smooth muscle. Okay. The mucosal, the inner margin of the mucosal surface of the bladder is lined with transitional cells normally. And the outside margin of the bladder is smooth muscle, but a little bit of fibrous tissue on the outside of that smooth muscle is the serosal surface of the bladder. If the bladder has only a small amount of fluid in it, the bladder wall itself looks a little thicker, and you may be able to make out there might be 3 layers of the bladder wall. If the bladder gets a lot of fluid in it and is distended with urine, then sometimes it stretches it out. Now it's thinner in appearance and it looks like it may only have 2 layers. So the bladder wall thickness is dependent on how much fluid is in it because it stretches it out like a big water balloon. Okay. And it should have 2 or 3 layers that are distinct inside the bladder wall itself. Sometimes on the caudal aspect of the bladder, on the dorsal portion where the ureters come in, there's a little tuft of tissue, little thickening of the bladder wall itself. And that's just the entry point of the ureter into the bladder. And those are termed ureteral papillas. And in some animals, if you're lucky, it's kind of fun that, all of us, when we're sitting, like when you're sitting there, when I'm sitting here right now, everybody doesn't constantly throughout the day make urine. Okay. It's kind of intermittent. Okay. You drink some water, and then that water ends up down in your kidneys, and your kidneys decide, okay, we need to make urine for a little while. And it makes urine for a little while until everything is back to normal. And then it might not make urine, rest. It doesn't make urine constantly all the time. And so sometimes you don't have any fluid flowing through the ureter at all because you're at a period where your kidneys are resting and they're not making urine. Other times you get urine that is pulsatile because it's pulsing through the ureters themselves, which also are made out of smooth muscle. How I'm getting around to this is every now and then, if you're lucky, if you put your probe near the ureteral papilla and the animal is actively making urine, you can actually see urine coming out of the ureter into the bladder. And it will be this intermittent spurting of urine into the bladder. It looks like little eddy formation as it pulses out of the ureter into the bladder. Normally, you don't see the urethra. So typically you can see the bladder, you can follow it caudally, and it kind of narrows down. But after that, you don't see a normal urethra. Okay, so it looks like a big water balloon, a big cystic looking thing. So here's a normal bladder. It's got a moderate amount of anechoic fluid in it. This is the bladder wall that you can see down in here. Here's another one that's moderately distended. And again, it's got layering. So if you look here, this part of the bladder wall, this is the mucosal surface, this bright white line. Okay. And then you got the muscularis layer, which is the more hypoechoic layer. And then this ill-defined line right here is the serosal surface. And so sometimes you can see 2 or 3 layers in the bladder wall, and it should be, very thin. So a couple of millimeters maybe in thickness. Oop. Well, I can do it here too. So the same thing that in this bladder. So you can see the layering in this bladder. You can see the layering pretty well. It looks like it's got 1, 2, 3 layers. Okay. If you stretch it out a lot more, then it might only have 2 layers, just to get stretched out. Okay. But it's nice and thin and smooth, and the bladder is full with anechoic fluid. If I go back to this slide, I want you to note another thing. So again, we see the bladder wall really well right here, where it is in that orientation. Okay. We don't see the bladder wall well here. The edge of the bladder here is kind of ill-defined. So keep in mind that with ultrasound, the resolution, the crispness of the detail of whatever organ we're looking at, in this case, the bladder wall, is always going to be best where that structure you're looking at is roughly perpendicular to the path of the ultrasound beam. So the ultrasound sound waves are coming out of the probe. They're going from top to bottom in this direction. Okay. Well, this part of the bladder wall is roughly perpendicular, almost 90 degrees, to the path of the ultrasound beam. And that's where the resolution is always going to be the best with ultrasound. Okay. Where the resolution is the poorest with ultrasound is over here. Here's our ultrasound, our sound waves coming out again from this area here, going down through the animal. Where the structure you're looking at is parallel to the path of the ultrasound beam is where the resolution is going to be poorest. So that explains why here in the apex, where the bladder wall is kind of in this direction, it's roughly parallel to the direction of the sound wave itself, you have poor resolution of the bladder wall. Okay, keep that in mind because that's going to be an important point here in just a second. Okay, so this bladder here doesn't have a lot of fluid in it. Okay, and the bladder wall, because of that, looks thickened. So this is all kind of a thickened looking urinary bladder here, here, and here. Okay, back here it looks thickened too. You have to keep in mind that if the bladder has hardly any urine in it, if it's only minimally distended, the bladder wall can look artifactually thickened. It's not really thickened. It's not pathologic. It just, until it gets stretched enough, until there's enough urine in it, then it will stretch out and look thin. But if you have hardly any urine in the bladder, a lot of times that bladder wall will look artifactually thickened. Okay, let's talk about a few benign things that can happen in the urinary bladder. Obviously, a very, very common thing that you're going to see when you get into practice is they get stones in the bladder. We talked about those radiographically, and we also mentioned that radiographically, some stones are radiographically visible. They're radiopaque, like these oxalate stones. And then we talked about there's some stones that typically on radiographs are more radiolucent, that a lot of times you will not see them on plain films. Okay, those are the urates and the cysteines and sometimes the xanthines. Okay, so with ultrasound, the cool thing is they all show up. It doesn't matter what the stone's made out of; they will all show up with ultrasound. So that's a good thing. That's to our benefit. So really commonly, these stones are easy to find. They're usually gravity dependent stones that are living inside the urinary bladder wall. If you agitate the bladder up while you're ultrasounding it, you can see them moving around inside the bladder and things like that. So they're not hard to find. You can measure them, you can count them if you really wanted to, things like that. Sometimes the stones are sticky. Sometimes they got little sticky margins and they stick to the bladder wall and they don't tend to move around. And so, but if you physically agitate the bladder, you shake it up while you're ultrasounding it, then sometimes they'll break off the wall and then they'll float around until they get stuck to another part of the wall. Okay, so here is a urinary bladder here, and he's got at least a couple of stones. So there's one here, it's smoothly marginated, kind of oval in shape. And there's another more jagged one up in here. And we note that these stones all have posterior shadowing. Okay, if they have a lot of mineral content in the stone, they'll cast hard shadows, very distinct shadows. Okay, like you see from here and here. If they don't have a lot of mineral content, you'll still see them, but they may not have much shadowing. Okay, here's little bitty stones. So these are a train of little, probably a couple of millimeter size stones. 1, 2, 3, 4, and a whole bunch of them sitting right in here together. Okay, if you kind of move the dog around, these are going to roll around inside the bladder. They're all gravity dependent. They're floating down to the gravity dependent portion of the bladder. Okay, and once they line up together, they will form a shadow from the collective power and numbers of the stones. If they're by themselves, they're probably too small to cast much of a shadow, but when they group together they will cast a shadow. Okay. The thing that you need to be cautioned on is right next to the colon, this guy here is a rounded shadowing structure. And I've seen a lot of people will confuse that as a stone inside the urinary bladder. And all that is gas and feces in the colon sitting next to the bladder. And if you get a bunch of feces in there and gas ultrasound doesn't penetrate through gas, so it causes this shadowing. And it's due to gas in the colon. Sometimes the colon gets so full it really pushes on the bladder. Okay, but you have to recognize that that's not a stone in the bladder. The bladder is actually going around it. It's just a colon and gas that's pushing on the bladder itself. Okay, blood clots in the bladder. If you have an animal with cystitis, an animal that's undergone trauma, sometimes they'll get blood formation or hematuria in the bladder. Sometimes if they banged, blunt trauma and then they get a bruise to the kidney, they can leak blood out of the kidneys that can go down the ureters and end up in the urinary bladder. Okay, so blood is heavier than urine. And so if you look, here's our urinary bladder. It looks thick-walled because it doesn't have a whole lot of fluid in it. But if you look here, there's this line. So all of this gray stuff in the dependent portion of the bladder is hemorrhage. Okay, so that's red blood cells that's sitting in there. And we got a few that are floating up in the bladder itself. But if you gave it time and the animal didn't move, all of this stuff would pretty soon gravity dependent and float, go down to the bottom of the bladder and join their friends. Okay, so typically that's hemorrhage in the bladder or hematuria inside the urinary bladder. If you shake it up, if you agitate it, it's going to swirl around like a snow globe, but then actively you can watch it all start to settle back out in the dependent portion of the bladder. Okay, cystitis. A cystitis is an infection of the bladder. Obviously, we probably all know what that is if you haven't experienced it one time in your life yourself. So cystitis typically will cause thickening of the bladder wall. So here's our bladder. It's really thickened up in here. Okay, and a lot of times with cystitis, you'll have floating debris. So white blood cells, maybe a little bit of transitional cells that's floating inside the urinary bladder wall, but a thickened bladder wall with floating debris in an animal that has clinical signs of cystitis would all make sense and go along with that diagnosis. The thing that I cautioned you about before is that what is another thing in a normal animal that will cause thickening of the bladder wall? And if you remember, that is incomplete distension of the bladder. If the bladder doesn't have much urine in it, the wall a lot of times will appear thickened. Okay, so that doesn't mean necessarily if you see a thickened bladder wall that the animal has a cystitis. You got to put it in correlation with the clinical signs of the dog. Do they have floating debris in the urinary bladder and stuff like that? So let's say that you get an animal that comes in, it's 10 o'clock in the morning, You ultrasound their dog for whatever reason, and their bladder wall looks thickened. Okay. How do you decide, is this due to cystitis or is this due to the bladder just doesn't have much in it? Well, again, you correlate with the clinical signs, you correlate with the, what the animal has, with the historical stuff that the animal's been doing, maybe a urinalysis result. But the other thing that you can do is you can re-ultrasound the dog a little bit later. So if it looks thickened now, but the bladder doesn't have a lot of fluid in it, you stick the dog in a cage, you give him a bowl of water, you tell your technicians, put a sign on the cage, do not take the dog out for a walk, and let him get him in there, let him drink some water, let him sit there for a couple hours, get him back out, don't take him for a walk, and immediately ultrasound him again and see if the bladder wall is still thickened and the bladder now has a lot of fluid in it. If it's still thickened when the bladder is distended, that would go along with a cystitis. Okay. So another thickened bladder wall with some flocculent debris sitting in the middle of it. Thickened bladder wall, flocculent debris, except now we've got this hyperechoic stuff that is, a lot of it is not in the dependent portion of the bladder, it's floating. So this is a emphysematous cystitis, so a cystitis that's caused by gas-producing bacteria that's forming bubbles to form inside the bladder, and those bubbles are going to float, not to the dependent portion, but float to the top of the non-gravity dependent portion of the bladder. And again, most of the dogs that have, and cats that have emphysematous cystitis, the majority of those are going to be diabetic. Okay, rupture of the urinary bladder. And this is, again, sometimes in life, I feel like the easiest things can become the most difficult and challenging things. Okay, so if I'm looking at this area here in the bladder, this is the same slide I showed you a while ago. Remember, I said that where the part of the anatomy is perpendicular to the path of the sound wave is your best resolution. That's where you see the anatomy the best. It's most well defined here. Okay, over here where the structure you're looking at is parallel to the sound path is where you see it the worst. Okay, that's the poorest resolution. Well, if you did a study and you took 100 dogs that had ruptures of the urinary bladder from trauma or obstruction, there's something stuck in the ureter that over time the bladder got so full it popped and ruptured, there's a tear in the bladder. Probably 90% of those dogs, the bladder will tear right here in the apex, right in the front of the bladder, which unfortunately sonographically is usually the part that you don't see as well. Okay, so don't be surprised if you have a dog that has a ruptured urinary bladder and he's leaking fluid into the peritoneal space. And in this case, it would be urine that's leaking into the peritoneal space. You might not actually see a defined hole in the bladder. There might not see a defined tear. And that's because that part of the bladder wall, the apex right up in here, is poorly defined on ultrasound. You can move your probe, try to get it at a different angle, and sometimes you're successful at that. But and it's not like a lot of times the urinary bladder, I described it as looking like a water balloon, but it's it doesn't have a rubber edge around it. It's got tissue around it, and it's got smooth muscle around it and things like that. So if you were to get a water balloon, and you stuck a needle in it, the water balloon over time, it's either going to pop completely and shrivel down to nothing, or else it's going to leak throughout that pinhole, and give it an hour, it's going to have nothing in it. It might slowly leak. Okay. Well, when you do a cystocentesis of a dog's bladder, it doesn't act like a water balloon. You'd put a needle in here, you get your urine, you take your needle out, and immediately that little pinprick hole seals up. Okay, because the smooth muscle fills in, the mucosal surface and transitional fills in. You may have a drop or two that may leak out, but overall, it's not going to leak out. And that's because the body, that tissue tries to heal itself. Okay, so the same could be true as if you have a small tear or hole up in here in the apex of the bladder. Okay, so if you have a really small tear up in this region, it may leak urine a little bit, but it may not leak all the time. And the bladder typically is not going to shrink down to nothing like a water balloon will. Okay. So the other thing to keep in mind with bladder ruptures is a lot of times you won't actually see the tear. And don't be surprised if the bladder looks like it's still moderately distended, but that can still have a tear in the bladder wall. Okay. You can still have a small tear, even though the bladder gets distended. Eventually, the bladder gets so much pressure in it, so much fluid in it, that if they do have a little tear up in here, it will unseal itself and allow that fluid to leak into the peritoneal space. until the pressure inside the bladder goes back down, and then the body seals it back up temporarily. So don't be surprised to see a moderately distended bladder and you don't see a tear in the bladder, but that doesn't rule out he doesn't have a hole in the bladder. He could still have a small tear in the bladder. Okay, ectopic ureters is normally the ureters should come in dorsal of the bladder, one on each side, and they hook into the top end, the dorsal caudal aspect of the bladder wall. An ectopic ureter is a congenital defect always, that the ureter doesn't enter into the normal place in the bladder wall, but enters more caudally and can enter into the urethra, the vagina, or the prostate. Okay. And in those animals from birth, from day one, they will constantly dribble out urine. Okay. If you have an animal that comes in and he is, 2 months of age and he's incontinent and dribbles urine, and you ask the owner, well, has that always happened? Has he done that since birth? If they say no, it's only been happening for, a week or so, then he can't have an ectopic ureter. Okay. It's got to be due to something else. Okay. The way to find ectopic ureters that enter into the wrong place is not ultrasound. Okay. Sometimes you can get a hint that a dog may have an ectopic ureter by looking at you see the ureteral papilla. And I said, sometimes in life you get lucky. Sometimes you can actually see urine coming into the bladder from the ureters. And if you don't see it on one side and you see it on the other side, that's a hint they may have an ectopic ureter on the side you don't see urine flow into the bladder. But again, we also said that ureters don't constantly make urine. So it may just not be making urine at that particular time. Okay. And so you can't count on it. And so ectopic ureters are usually diagnosed nowadays with an IVP, a contrast procedure that we briefly mentioned with radiographs, and CT, computed tomography. So radiographs are not very good for looking at those. Ultrasound is not very sensitive for looking for ectopic ureter. So if you have one of these suspects animals that comes in, they have a suspect ectopic ureter. Again, the key is they've been dribbling since birth, probably to definitively diagnose that, and they can be surgically fixed. But to definitively diagnose this, first thing I would do is turf it. I'd turf it to, a specialty center and let them do a CT IVP. Okay, malignant bladder disease. The only one you really need to worry about is transitional cell carcinomas, which is a very common tumor. Unfortunately, it lives in a bad place. They live in the trigonal region, so they live in the caudal dorsal aspect of the bladder wall, typically where the ureters come in and the urethra goes out. They are aggressive. They invade into the bladder wall. They readily metastasize to lungs and to bone and to the lumbar vertebrae adjacent to that area. So it's a nasty tumor to get and can cause bladder urinary obstruction. So here's our urinary bladder. This is a great big large mass that lives. It's attached to the bladder wall in here. And this is a great big large mass. Not much else looks like a transitional cell carcinoma. They can become very big. They can take up almost the entire lumen of the bladder, and very irregular shape. Sometimes they'll have little focal areas of faint mineralization inside them. Unfortunately, because of their location, surgery a lot of times is not an option to take them out because you'll do more harm than good by taking them out. And they don't respond well to chemotherapy. They don't respond well to radiation therapy. It's a nasty tumor for these animals to get. Usually a pretty damn poor prognosis. Every now and then, I would bet 85 to 90% of transitional cell carcinomas live in the trigone. Probably 10 or 15% will live up here in the apex. If it's one of those atypically located transitional cell carcinomas that live in the apex or right here or right up in here, then surgery is an option. You can go in and take out half the bladder, okay? As long as they're not located where they usually are in the trigone, you might be able to take them out. So here's another nasty transitional cell carcinoma. You can see it's got these punctate areas of mineralization inside of it in here. So large mass. The ureters would come in here. They can't empty their urine into the bladder because this mass is in the way. So then again, your urine will back up into the ureter and eventually back up into the kidneys, and you get hydronephrotic kidneys. Okay, reproductive system. So let's talk a little bit about females and male repro stuff. Sonographically, the ovaries, most of the time you're not going to see them. And most of the time that's because they're not there, because in most, developed countries, a lot of times we tend to spay the animals when they're young. And so we take the ovaries out. If they're intact, and then a lot of times you will see the ovaries. I'll show you an example in a minute. You have to know where to look for the ovaries. We kind of talked about that with radiographs. Typically, you're going to look caudal to each kidney, in the fat caudal to each kidney, and that's kind of where the ovaries tend to live. In most of these dogs, they look like a little, almost like a lymph node, a very small little hypoechoic oval shaped structure. Okay. If the animal is in heat, so if they're in certain phases of the heat cycle, then they may get little cysts on each ovary that you can see. And sometimes those cysts can become big, but they should kind of go away as the animal goes out of heat. Okay. So here's a kidney here. That's the caudal pole of this left kidney here. Okay. And this little oval shaped thing that lives caudal to the kidney, that's an ovary. That's a normal looking left ovary in that dog. Okay. Here's the right kidney here, caudal pole of the right kidney, and there's the right ovary, kind of smoothly marginated, homogeneous, well-defined little, oval shaped structures that live caudal to each kidney. That's typical appearance of an ovary. Okay. So what do we see with ovaries? Sometimes they get little cysts, and sometimes the cysts don't mean anything. But if you get these large mass lesions, so we got this very large mixed echogenic, large oval shaped mass. This is on the other side. So obviously very abnormal in appearance, got a bunch of cysts all inside of it. So there's nothing in here that would, if I just looked at this by itself, there's nothing in any of that. By looking at this, I can tell you that's an ovarian mass. Okay. But I know it is because we found this on either side where the ovaries live, and it was an intact female. And I don't see normal ovaries. And so you can bet your bottom dollar she has bilateral mass lesions associated with either ovary. On the left side, it's not as big as on the right side. So this particular dog had bilateral ovarian adenocarcinoma, so large mixed echogenic ugly mass lesions. I don't see normal ovaries, and both of these lived where the ovaries normally live. Okay. The uterus, in most dogs you don't see. However, if they are in the middle of heat, sometimes the uterus becomes a little more edematous and a little more thick-walled, and you can see it. You can even see it sometimes on radiographs, but you can for sure see it usually on ultrasound if they are in heat. If they're not in heat, sometimes you're hard-pressed to actually find exactly where the body of the uterus is, because it's not very easy to find. Okay. Uterine pathology. The big one that you need to worry about for you in most cases is this one here, the pyometra, which is a bacterial infection of the uterus. We've talked about a pyometra with radiographs, so the uterus becomes really big and dilated, fluid filled, it's full of pus. Radiographically is pretty good for looking for pyometras. You have to, again, where to look. It's located typically between the colon and the urinary bladders, where the normal uterus would live. So you look for a fluid filled, tubular-like structure in that area, sonographically and radiographically. Other conditions, very uncommon, you'll see mucometras. So instead of pus in the uterus, you have mucus in the metra. Hydrometra is water or fluid, serous fluid in the uterus itself, or hemometra. So that's the uterus that's full of blood. But pyometra is, in dogs and cats, is the most common one by far. Endometriosis, endometritis, is a thickening of kind of scarring tissue, little polyps that form inside the surface of the uterus. Pretty rare in dogs, but you will see it every now and then. And then if it's an older intact female, you can get uterine neoplasia. So the ones that you would see, the uterus itself, we know is made up of smooth muscle. And so the smooth muscle tumors, the leiomyosarcomas and the leiomyomas, and the uterus lining is lined with glands, say the secretory glands. And so adenocarcinomas can also happen in the uterus. So pyometra, this is an enlarged, dilated, fluid-filled uterus. There's another piece of it here. Remember, these are kind of tubular, and they're winding in and out of the screen and, overlapping themselves and things like that. So this is a large dilated uterus. In real time, you can follow it around. And again, it's dilated, and you find out where the uterus lives. This is up by an ovary here, so a little more cranial. So here's a dilated fluid-filled uterus. If you look here, there's these little indentations of hyperechoic tissue that goes in the side of this fluid-filled uterus. These are placental sites in the uterus. So they're little, I don't know what they're, little focal areas of lymphoid or secretory tissue called placental sites inside the uterus. This dog also had a big ovarian mass here. So a mixed echogenic mass in the ovary and a big dilated uterus, probably a pyometra that went along with that. Okay. This one here, there's the urinary bladder. I see here, and dorsal to the bladder in this intact female, we had a really thick-walled uterus. I was betting actually that this was going to be, it was an older dog, so betting it was going to be some type of uterine neoplasia. They spayed the dog, took it out. Histopathology said it wasn't neoplasia, it was endometriosis. So again, there's sonographically, there's no way to know for sure. Okay, pregnancy of dogs. So let's talk about pregnancy, and we're kind of compare this back to radiographs. And we remembered radiographically, we said typically you can diagnose pregnancy radiographically. The dog has to be how far along in pregnancy before typically you can diagnose it radiographically. And if you remember, that date was in the 40 to 42 day range. So not very good, because that's already, 2/3 to 3/4 of the way through pregnancy before you're going to be able to diagnose it. Well, ultrasound can diagnose pregnancy much sooner than radiographs. So it's much more sensitive, and you can diagnose it much sooner than you can with radiographs. So ultrasound is good for diagnosing pregnancy. There's no radiation exposure. Not that if you shot a radiograph or two of an intact female pregnant dog, it's really going to do much damage to the fetuses, especially if they're chihuahuas, which you probably can't do any damage at all. It's already there. And it's much more sensitive. You can diagnose it earlier than you can with radiographs. And it's really good because with ultrasound, there's no guessing if the fetuses are viable or not. You can actually see heartbeats and the fetuses start to move around and stuff like that. Ultrasound is not good if you want to count the fetuses. I told you that even radiographically, that is somewhat difficult to count fetuses, because if there's a whole bunch of them, if the dog has 10 fetuses, they all tend to overlap on radiographs, and it can get confusing on to get an accurate count. And again, I would advise you to never put down an exact number, because you just never know. Okay. And ultrasound is also not good, as it is in people. It's not good for predicting an exact whelping date. Don't even try. It's just not going to happen. Okay. The earliest reported diagnosis of pregnancy in a dog is at 11 days. Okay. So at 11 days, typically you're going to see a 2 or 3 millimeter diameter little cystic area in the region of the uterus. Okay. That's what you typically see. And that's the earliest report, is about 11 days after conception. Okay. That study was done out of Penn, University of Penn. And we do know that Penn is the only Ivy League vet school. They're the only vet school in the United States that they don't graduate DVMs, they graduate VMDs, right? And because of that, Penn tends to, let's just say, blow its own horn and exaggerate things. And so some of the studies that come out of Penn, I think everybody else kind of scratches their head a little bit about. And that's one of them. So there's no way in hell, if you pressed me, I would say I'm going to try to diagnose pregnancy at day 11. Okay. It's just not 100% for sure. It's kind of iffy. Okay. Probably a more realistic time is maybe a few days after that, when those little cystic areas get to be at least 1/2 centimeter big. Okay. On the other hand, it's still a little bit iffy. Okay. So I typically, if I get a phone call and it's some client and they go, when can you die? I want to bring my dog to see if it's pregnant or not. When's the earliest I can do after conception? I usually say, we're going to wait till 3 weeks, 21 days after it's conceived, right? And so at 21 days, I feel really comfortable. It's pretty much 100%. You can diagnose pregnancy 100% by around day 21. And again, that's half the time that you can do it with radiographs. So radiographs day 42 or so, ultrasounds day 21, 3 weeks into pregnancy. That's pretty good. Okay. Also, it just so happens at the same time, at about day 21, is the same time you start to see hearts and heartbeats. So you can actually see the heart pumping of these little fetuses. Okay. So each one of them by day 21, not only can see them, but you can start to make out hearts, and you can barely see these little hearts start to pump a little bit. Okay. By about day 28, now the fetus will start to jerk around a little bit. They'll start to move around. And then shortly after that, you start to see definitions of some of the internal organs. So you'll see brains. You can actually see ventricles in the brain. You can see little kidneys. You can see little livers and things like that inside those fetuses by day 30 and on. Just like in people, the closer you get to when the dog is going to have puppies or whelp or queen, if it's a kitten, the closest you get to that, the more mineralized bony structures those fetuses are going to have. And the closer you get to birth, the harder it is to ultrasound them because, again, now we got osseous mineralized structures that ultrasound can't penetrate and causes shadowing. So there's this kind of a sweet spot in the middle of pregnancy where you can see all kinds of organ definition, but if they get too long, then you got all this bone in the way and you can't really see it anymore. Okay, so here is head to the left, cranial to the right. So here is, there's a fluid-filled uterus right in here, okay? And if you look, it looks like a fetus, right? So that you can make out, it looks like there's a spine right up in here, there's a big old skull right up in here, okay? No overlapping skull bones, everything looks good. Almost probably a little ventricle in the brain right in here. And right in here, if you were looking at real time, that would be the heart to be beating, okay? It'd be beating pretty good. And here's abdominal organs down in here is another picture here. So here's, looks like ventricular region in the brain, calvarium right in here. Okay. And that looks like a little, paw or something right up in here, more uterus, placental side up in here. So let me ask you this. If you're looking at that picture, obviously there's a fetus in this fluid-filled uterus. If you're looking at that picture, what breed of dog would you think that might be? What do you think? I'm waiting. Anything? Are you muted? Yeah, like a brachycephalic, what's an example of that? Bulldog. Bulldog. Yeah, that's what everybody always said. Well, that's got to be a bulldog. Well, truthfully, that's my daughter. Okay, so that is my daughter, Jillian, who is now getting ready to graduate from A&M and wants to be a veterinarian. So Jillian's not a bulldog. That's her in utero. She's sucking her thumb there in utero. So yeah, that's Jillian. She would die if she knew. I've been showing this for 20 years. But anyway, that's Jillian. So here's heartbeat. So here's a fetus. So again, you can see here's a ventricle in the heart. There's another ventricle in the heart. That's the interventricular septum. So again, in real time, that thing would be moving. Okay, and it'd be beating. Okay, so it's easy to tell heartbeats in dogs, again, after usually about day 21. Okay, well, how do you tell ultrasound wise if the dog or kitten in utero is not alive? Well, it's kind of common sense. If you don't see a heartbeat after day 21, that might give you a clue, right? If you see gas accumulation anywhere in the uterus or in the fetus, again, there's no reason these animals have, in utero have never taken a breath in their life. And so you shouldn't see any gas reverberation artifacts anywhere inside the uterus or a fetus. If you do, that usually means they're resorbing, and that's not a good thing. Okay. If you don't, after about day 30, I said you start to see definitions of organs. You start to see little livers and ventricles in the brain and stuff like that. If you don't see that after day 30, then that's not a good thing. It usually means that it's becoming a mummified like fetus, or the body's trying to resorb it. Okay. And again, after about day 28 or so, they should start to move around, jerk around, and stuff like that. If you see, you got 5 puppies that you see and you got 4 of them that are moving around and one of them just sitting there, that's probably not a good thing. Okay, so this is an example of a resorbing fetus, that didn't take. So a mummified fetus. Again, without knowing history, knowing where this is located, I wouldn't have a clue what that is or where that is. Okay, but knowing that this is a dog, and I think this dog had 9 or 10 of these, so none of them were viable. Ended up having to spay the dog. Okay, the postpartum uterus. So what does a uterus look like? How should it look like immediately after the dog whelps and the next few weeks after it whelps? And there's a scenario why this is important. Here's the only thing I want you to know in this particular case right in here is this statement right here. Okay. A uterus normally will contain debris, that's flocculent debris floating in the uterus itself, the tubular uterus, for up to about 3 weeks. Okay. And that's because there's still a little bit of tissue in the uterus, a little bit of tissue that's broken off from the mucosal surface of the uterus. There may be a little hemorrhage, a few little blood clots still in the uterus, things like that for up to about 3 weeks. Why is that important? It's important because very commonly you will have a patient, a dog, cat, whatever, that comes in. They had puppies, kittens. They're doing great. Everybody's nursing well. Mom's doing good, and you get about 2 weeks into it. Okay. And then suddenly the mom doesn't want to eat and she may not really want to take care of her puppies anymore. And she's just, malaise and acting lethargic, spikes of fever. And you're thinking, uh-oh, what the hell's going on? And so you're thinking, well, this dog, maybe she's got a pyometra, because getting a pyometra after dogs and cats have puppies and kittens isn't very unusual. And so you ultrasound your probe, or ultrasound the dog. And so you get your probe out, you stick it on the dog, and you think, oh crap, there's a uterus, it's got fluid in it, and it's got all this flocculent debris inside of it. It looks like a pyo. But then you have to caution yourself. Well, it's still within about 3 weeks of them having puppies and kittens that could be normal. Okay. If it's after about 3 weeks, yeah, the dog's probably got a pyo. And so if it's within 3 weeks, again, that could be normal. And if it's spiking a fever, it doesn't feel good, probably your most likely scenario is instead of a uterine infection, might have mastitis. Okay. Some of those little needle sharp puppy teeth might have penetrated the teats of the dog and might have an infection of one of the teeth. And so you always want to palpate, make sure not one of those mammary glands isn't big and hard and warm and got an infection in it. So the only thing on this slide you really need to know, the uterus can usually contain debris for up to about 3 weeks after they whelp or queen. Okay, then we're going to talk about male dogs. So males is a little bit easier. So here's testicles. And kind of as a general rule in life, if you're ultrasounding the abdomen of an intact male dog, you consider the testicles to be part of the routine abdominal ultrasound. So if they're hanging, you scan them. Okay, so that's part of your typical routine, and it's good for a lot of reasons, but you always want to make sure it includes. So here's a kind of a normal looking testicle. So it's kind of this oval shape. The echogenicity and cortex of the testicle looks a lot like a spleen. It's very smooth, very homogeneous in appearance. So the testicle should be nice and oval in shape. All normal testicles will have this white line, this light hyperechoic, thin white line right down the middle of the testicle. Okay. If you turn your probe 90 degrees and you're axially oriented across that testicle, then it'll feel like just a little dot in the middle of the testicle because it's coming out at you. Okay. So the testicles, both of them should be happy, healthy, homogeneous. The little white line down the middle, that white line, which you might need to know coming up, is called the mediastinum testes, or the other name is the rete testes. Okay. That you can see right down the middle of the testicle. Okay. And the right side testicle should typically look pretty much just like the left side of the testicle. Here's a testicle here. Caudal to the testicle, this little tubular, fluffy looking thing down in here, that is the epididymis of the testicle. So it's kind of on the caudal pole of each testicle is a normal epididymis. Okay. So some abnormalities that you can see with testicles. Orchitis is an infection of a testicle. It's pretty rare. This is an infected testicle. It's got all this abnormal blood flow inside the testicle. So an infected testicle. I have never seen a case of that in my career of almost 25, 30 years now. So it's obviously pretty rare in dogs, but unfortunately, apparently pretty common in people, which is really unfortunate. Okay. Testicular neoplasia, on the other hand, is pretty damn common in older intact male dogs where they get mass lesions inside the testicle itself. There's kind of a hyperechoic to isoechoic nodule sitting right in here. There's another hypoechoic nodule sitting right in here. That mediastinum testes is kind of coming in this way and being diverted because these are causing mass effects inside the testicle. Okay, these are a couple of them that are a little more obvious. These got little mass lesions here and over here and cavitary areas inside the testicle in that area. Okay, so it's important to diagnose testicular neoplasia. How would you get a specific? You could stick a needle in there to get a specific diagnosis. On the other hand, the easiest way, fastest way is just to castrate the dog, send the testicle off for histologic analysis, send the whole damn thing off, and they'll know. You'll know definitively if it was testicular neoplasia and what kind. Some of them are more aggressive than others. And so you want to know what kind of neoplasia it was. Prostate glands in dogs. As we said radiographically, the prostates are variable in size. Sometimes they're easy to find if the dog is intact. Sometimes they're hard to find if the dog was spayed really young in life. So where do you look for a prostate? Well, here's the urinary bladder. Here's the neck of the bladder. And it's this little oval shaped thing that I see near the neck of the bladder. That's a mild to moderately enlarged, normal appearing prostate. Dogs that get benign prostatic hypertrophy, the prostate becomes really big and pretty damn big pretty quickly. So even if a dog is a year of age, the prostate can already be pretty damn big, okay? Much less when he's 6 or 7 years of age. So we know that benign prostatic hypertrophy is driven by testosterone. So the testosterone coming from the testicles enlarges the prostate just like it does in old men as we get older, right? So it causes your prostate to become big. Typically, the prostate can become really, really big with prostatic hypertrophy. The right side of the prostate still should look pretty much the same size as the left side. The prostate can contain a few little cystic areas. It become a little heterogeneous in appearance. What you don't want to see is here's some cystic areas in there. Those don't worry me too much. Prostate's big with a few cystic areas. If those cystic areas start to coalesce together, and especially if they become thick walled and start to have a bunch of debris inside it, then I start thinking there could be little abscesses. And now we've got a dog with an infection of the prostate with a little abscess formation or prostatitis. This has pus all the way around the prostate, and there are a bunch of these little abscesses inside the prostate. Again, real easy. You can stick a needle in there and you can get pus and culture it if you really wanted to. This animal has an enlarged prostate, a bunch of little cysts in the prostate. In and upon itself, that wouldn't bother me too much. But right next to the prostate, he has several of these large cystic areas that are not in the prostate. They're sitting next to the prostate. And these things are called paraprostatic cysts, meaning right next to the prostate. And they can get 3, 4, 5 of these things, and they become huge. They can become bigger than the prostate, bigger than the urinary bladder. And again, they're benign. But they get so big, they can cause the animal to have trouble defecating because they're putting pressure and squishing the colon, okay? Benign paraprostatic cysts like this, they can go in surgically and remove them, but the key is they will come back sometimes, but they will especially come back as if at the same time you don't go ahead and castrate the dog, because these things also are influenced by testosterone. So take the paraprostatic cysts out, castrate the dog. Sometimes they still come back, but a lot of times they'll stay small and you'll give the dog some relief anyway. The thing you don't want to see is mineralization in a prostate. Just like we said with radiographs, if you see hyperechoic areas of mineralization with faint shadowing inside of a prostate, typically that's going to be prostatic adenocarcinoma. That's a cancer of the prostate. So radiographically, remember, we said 2 things. One, if you see mineralization in the prostate of a dog or mineralization in the adrenal gland of a dog, both of those are very suggestive of prostatic or adrenal adenocarcinomas. In a cat, again, we said mineralization of an adrenal gland is typically incidental. But mineralization, you don't want to see mineralization in the prostate of a dog. That's usually a cancer, okay? You can stick it, you can biopsy it, and that will define it for you, but that's what you don't want to see. Okay, tomorrow we are going to pick up with abdominal glands and lymph nodes and continue on with GI system. All right, so that's it for the day. Hope you all have a good rest of your day, and I'll see you in the morning at 10 o'clock. Thank you.
Bye.
Bye.